And we're back 17 on set. Joining us this morning, Dr. Ravi Patel with Comprehensive Blood and Cancer Center. And we're talking about the dangers of indoor and even outdoor tanning and skin cancer and melanoma and how a sunburn and a tan could affect that. Good morning, doctor.
Good morning, Jason.
Great to see you. Thanks for coming in here. And I mean, it's summertime in Kern County, and we all know how brutal the heat and the sun can be here. The UV index is always so high. And so sunburns happen often, and they're very dangerous.
True. And you see, what happens is that it's summer vacation. Children want to run around the pool. They go outside, swim, out in the sun for a longer duration of time. And what's happening is that the most rapidly rising cancer today is melanoma, particularly in the younger generation. And people think, well, let's go and just get a suntan. It's a lot safer. Or rather, go to the tanning booth. But the tanning booths actually have 10 to 15 times more UV exposure than regular sun.
Concentrated.
Very concentrated. And it's so bad that the FDA in December actually proposed a ban for people younger than 18 to go for sun tanning.
And so how many sunburns or how many tanning sessions do I need, whatever? You know, is there a limit to that will expose me or maybe increase my risk?
The best thing is avoid the tanning booth. And the other thing is, if you want to go out in the sun, choose the right times. Early morning, later in the afternoon. 10 to 4 is the worst time to get out in the sun.
Let's talk about sunscreen real quick, because everybody says, well, I just wear sunscreen, you know, and there's all these SPFs, 30, 50, 75, you know, I think they go up into the 100s now. At what point, I've heard that those become ineffective at a certain point, right?
Yeah, very important, and that's a very critical question. Just because you have sunscreen doesn't mean you're not going to get sunburned, you know. And the important thing is that sunscreens last for about 2 hours. So, you know, some last longer, but in general, it's a good idea to just reapply it after some time. And don't get prolonged exposure. No matter what you have on, just go in and out of the sun, and particularly younger children.
And the SPFs, does that number, the bigger the number get, does it actually make a difference?
It does, and it does protect you. But the best thing which protects you is not prolonged exposure. And not getting sunburned. The more chances of getting sunburned, the higher the risk of melanomas. Particularly young women think that, you know, just getting tanned is safe or getting a base tan is safe. Not true.
No such thing as a safe base tan, says Dr. Patel. Doctor, thanks so much for running short on time here, but we appreciate that. CBCC, if you have any questions there. Thanks so much. We'll see you soon.
Thank you, Jason.
All right, we'll be right back.